Well, hello, friends. This is going to be an interesting episode today. We're talking about something we haven't addressed yet on the show today. We're talking about pain. And it's a really important topic because let's face it, for those of us who live with chronic pain, it's a huge barrier to experiencing joyful movement, the barrier to movement at all, lots of times. So we have a really special guest on the show today who's going to help you move from pain to possibility by sharing a really unique perspective on pain. I'm really excited to introduce you to Dr. Andrea Moore. She's a mom, a wife, and a recovering health perfectionist. Me too. Her career path has been based on trying to fix everything wrong with her, from chronic pain and post-concussive syndrome to anxiety and ADHD. While she refused to accept this as her norm, trying to implement what she thought was necessary to alleviate her symptoms felt exhausting, restricting, and impossible. Along her 15-plus-year journey, she became a doctor of physical therapy, an orthopedic certified specialist, functional nutritional therapist, life coach, and patriarchy and perfectionism smasher. Yes. And then through years of education, self-healing, and working with hundreds of women, she's learned that it is always about coming back to yourself in order to live the life of your dream. She now guides other women who are suffering from chronic pain back to their bodies and living in a way that is aligned with the truest version of themselves. Oh, sounds amazing. Welcome to the show, Dr. Andrea.
Thank you. I'm so excited to be here.
I am so excited to have you. So let's get right to the good stuff. Can you tell us a little bit more about yourself and the journey you took into doing this work that you now do?
Oh my goodness. Yeah. And I always tell people it's like my journey is all over the place. I've tried everything, done everything, but my journey was as much about a physical journey, but it was also about the emotional journey behind it, because it's ultimately how we respond to our bodies and ourselves that really impacts things that took me a really long time to learn. So I started out, probably in high school, college, basically reading a lot of mindset, like thinking already that something is deeply wrong with me.
Mm.
And basically put on this mask of everything is fine and I'm just supposed to be happy and think positive. And I saw other people being happy and I just didn't believe it was possible. I was like, they must all just be faking it. Like, I don't understand how anybody can just walk around feeling happy and grateful all the time. So
Mm.
I just made a decision that it was like, well, if I can't feel those things, I will at least fake it, because that seems better than the alternative, which is walking around in a body that hurts and feeling miserable. And so went to PT school, and it was really working with people that I started realizing that what I was experiencing wasn't normal. And like, I kind of just thought everybody felt like this, and I was the one who just thought something was wrong with it, if that makes sense.
Mm-hmm.
And including just being in pain. So it wasn't until I was asking my patients, like, okay, you're here for knee pain. Does anything else hurt? And people would be like, no, nothing else hurts. And I'm like, are you sure? What do you mean nothing else hurts? What? How do you not, you mean, I'm like, no, you like back pain or hip pain. Like, you just, and they're like, no, like nothing hurts. And so I was like, oh, not everybody feels like this all the time. And so I started really getting curious about it. And along the way was meeting other people. Like, I kept getting chronic pain patients on my schedule who were experiencing the same thing that I was, that like mirrored, just like everything hurt. Emotionally, they were having a really hard time with it. And I felt like there was nothing in my education that taught me what to do about it.
Mm.
So I just wanted to learn more, both for myself and my clients that I was seeing, because I just refused to be like the attitude from others and my mentors was just like, well, there's just some people that are like that. It's just like kind of in their heads. Like, you just got to deal with it. They need to learn to accept it and move on. And I'm like, no, there's no way this can be it. It just didn't make sense. And so, and to make a very long story short, because I could go on for like an hour, it was really learning both about how chronic pain worked through like the research-based neuroscience that I learned through like my doctorate and through a lot of continuing education on it. And it feeling like it was giving me a lot of information, but it just always felt like something was missing. And so it wasn't until I was really exploring I was personally in a really dark place, especially I had a car accident and post-concussive syndrome. I'm kind of like glossing over big details here. And I was in a really dark place emotionally. And when I was seeking out help for that, I came across the more trauma-informed world that was really diving into what our bodies are holding, what our nervous systems are holding on an unprocessed emotions and traumatic level. That I was like, this is what's been missing. Nobody in the chronic pain world, well, they were sort of talking about it. They just weren't saying what to do about it. It's like it was acknowledging that emotions and traumas can contribute to chronic pain, but there was no like what to do. They're like, I guess you just meditate, and or it was like, well, they just have trauma, so that sucks. They're stuck in chronic pain. Like there wasn't this what to do. But then this whole other world held the answers of what to do about it from an emotional level, but they were missing what to do about it when it was physical. But I had both worlds. Like I now had the knowledge of both worlds. And so I really was able to bridge the gap. And in bridging that gap, I not only was able to help my own clients, but I also discovered on my own path that it was possible to feel happy and to feel these emotions and that everyone wasn't faking it, or that, people really were feeling joyful and whatnot in their day-to-day lives. And it wasn't a farce, So it was in healing both the emotional side and the physical side for myself and clients that really got me to where I am today. And that was,
I cannot wait I have so many questions that I want to dig into here. But like, you're right. I mean, as a person who's read a lot of self-help books along the way, I am not new to the idea that emotions get stored in our bodies and that they can manifest as aches and pains and things like that. But you're right. Nobody tells you what to do about that.
Yeah.
Like, I've known this for years. And I'm like, okay, great. So, I
right?
guess I'm broken. Like what do I do now? Right.
Exactly. And that's exactly what I was feeling. It's just like, well, I'm broken. Like that was like, or I'm like, well, now I have to fix this. What's wrong with me? And
Okay. So let's go bit by bit here.
Mm-hmm.
First of all, let's start at the beginning. How would you define chronic pain?
Yes, it's a great place to start. So chronic pain is really any pain that goes, and you'll see different people define it differently, but really anywhere past the 3 to 6 month mark point of having pain. It can be isolated to a body part. It could be systemic, like widespread and multiple body parts. It could even, I'll even classify pains that, and this what I would put more past the 6-month mark, where you're having pains that move around. So like maybe you're chasing symptoms. So maybe you are started with knee pain, but then it spread to your hip, and now it's in your other knee, and now it's in your foot, and now it's back to this knee, right? It's kind of like this chasing of symptoms. But it's really as simple as that. It's just pain that's been going on for more than 3 to 6 months.
Okay. Why do we have pain?
Yeah. So we have pain, and pain is super important. Like we need pain. So it's like if you stepped on a rusty nail, would you want to know about it?
Yeah, I think I would.
Mm-hmm. Right? Because if not, you could get tetanus. You could just be bleeding out and having no idea. Like we need to know. If you put your hand on a hot stove, you need to know that your skin is melting away, right? Like you're just deep in conversation, you lean back and you have your hand on a stove. It's like you need to know. So pain protects us. Pain is here as a protective mechanism. And so when we are, touching a hot stove or stepping on a rusty nail, it's the signals that are getting sent from the nerve endings. There's no pain signals in the body, but there are danger receptors. And they send a message up to the brain. The brain interprets the message it's getting, and it's going to be like, oh, ding, 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 danger. Or like, man, no, we can ignore this. Like it makes the decision and then sends the message back down as pain. So pain is like a top-down driven mechanism, but it is like it happens because of a bottom up. So some people like to try to be like, oh, it's only because of your brain. And it's like, yes, your brain is very much responsible, but it is because of the messages it's receiving from the body. And I always like to tell people, if anybody has ever told you that your pain is all in your head, if it happens to be a male doctor, I'm just going to call that out, that you can kick him in the balls and be like, guess what? The pain you're feeling's in your head too, because all pain is driven by the brain. Like that's just how it works. That's not like nothing has gone wrong if pain's in your head, because pain is always decided by from your brain. Because if you were running from a bear and you stepped on that rusty nail, your brain would also turn the pain off.
Right.
Because it could decide in that moment, based on what's going on, I need to turn off this pain because it's more important to get away, not to stop and look at the foot. So yeah, so the brain modulates it, but it is very much a feedback loop from the body. And that's the piece that gets missed a lot, is what the nervous system is holding on to. So
right.
Yeah, go ahead.
So that was my next question, is like that explanation you gave explains very well how we respond to acute pain and danger,
Yes.
something that happens in the moment and you feel hurt. So yeah, I'd like to hear more about this nervous system connection then, because how do we explain chronic pain that no one can find a reason?
Yes.
Right? Like,
great question.
your knee looks fine. I believe that it hurts. Why does it hurt if there's nothing?
Exactly. And so there's always going to be like two, I mean, there's way more than two. Pain is very complex. There's so many factors that contributed to it, but let's simplify it down. Let's say there was an acute injury that turned chronic. In an acute injury, in the healing process, the sensitivity of the nervous system, because it's like right after you have an injury, around the area is going to be extra sensitive, right? And that's just because the body is protecting it so it can heal. We want that. And then that sensitivity should ramp down and go back to baseline. In 25% of people after an injury, it does not go back down to baseline. It stays hypersensitized. So it stays extra sensitive and in pain, even though the injury is healed. 25% is a massive amount of people. And that can be from an actual like wound, or, actual sprained ankle, or just a tweak. Like that sensitivity can stay heightened. And so in that case, after an injury, if it's past the 3-month mark, that is when it turns chronic, because it's what that signifies is that it is not a tissue issue. Like it's not a problem with your muscles or joints or tendons or ligaments. It is a nervous system issue. It is a pain issue, because it's just the nervous system that is now that has remained hypersensitized. So it's kind of easy to look at from after an injury, but what about when there's no injury? There's no mechanism. You're like, it just literally woke up one day and I had pain. And that is a lot of what I see. I see about 50-50. And I'd say it's slowly gearing more towards people who just woke up one day and had no pain. And in those cases, it is because the nervous system is being sensitized by something else. Pain is always when the body is perceiving more threat than safety. And so that threat is, we tend to only think about it in the sense of, oh, there must be a threat to our tissues, to, bones, muscles, ligaments, things like that. But that threat can actually be anything. That threat might be an emotional, like you go to your job that feels like you don't feel safe in it. Maybe your boss treats you like crap, or there's a really, there's a person you have to interact with that makes you feel really uncomfortable. That's a threat. And the nervous system over time might start creating then pain. For a lot of women, speaking up could be the threat. Taking up space could be a threat, because the nervous system, and then it's looking at why is the nervous system holding that as a threat. And then the other big piece is that just as we suppress our emotions, as emotions go unprocessed, unfelt, unheard, that just gets stored up in the nervous system. And it's almost like a lack of space for the body to hold anything else. And over time, the nervous system is just like screaming out to be heard and to release what it is holding on to. So all of that can contribute to chronic pain.
So how then does the pain act as a way to keep you safe when you're experiencing an emotional threat?
Yeah. So it can be in a couple different ways. So like in a scenario where it's like the scenario itself, like going to a job, for instance, like, and I've literally had people, I had one person who comes to mind right now. It's like on the way to work, he would have pain driving there.
Yeah.
And then he'd have pain all day at work, and then driving home, by the time he'd drive home, it'd be gone. And on weekends, it didn't matter where he could drive anywhere and have zero pain. And it's like, maybe it's your job. Right. And so, yeah, right. It was fascinating. And so the body in that case, I always want to say, like, we can never apply logic to the nervous system. We can try, but it's really about getting to know the nervous system and why and understanding why it's doing it. That's always going to be the best, way to understand. But you can kind of look at it as face value of, if you're in pain, that might be a good way to stop you from going. Right. It draws your attention of like, ooh, this scenario might be unsafe. Right. If you're, around somebody who makes you feel unsafe and your body's tightening up, one, it's that physiological tightening that can lead to muscles hurting, but also it's like your body be like letting you know this is not safe. Yeah. Chances are the body has been whispering and telling you this, and this, and we just haven't been listening or we haven't responded to it. And so the other way, especially for a lot of the women I work with who are entrepreneurs, who are showing up in their field and their, careers, showing up online, using their voice and speaking out against the patriarchy, for instance, that's a literal threat that the nervous system is holding on to from generational trauma. Yeah. Because historically, it has not been safe for a woman to use her voice. That can get you killed. So the nervous system is like, stop that, right? Pain's a great way to stop you from doing something.
Speaking of the nervous system, I just got goosebumps all over my whole body as you were saying that.
Yes. That's like energy moving through right there, right? Because it's like, if you hurt too much to now record your podcast or to write that blog post or to, post that idea that you thought of or that thing you wanted to say, and like pain stopping you and distracting you, then
it keeps you safe from that perceived threat. Okay, so here's another thing I see a lot in my work. As someone who encourages women to disconnect movement from weight loss, I encounter a lot of people who have a history of using exercise as a form of punishment, where it was really about like working as hard as they can, trying to achieve metrics, get PRs, like change their weight. And now and so as they unpack that and they're disconnecting from that, they feel a lot of resistance and pain in their body when they're trying to exercise even in a more like friendly, like kind and compassionate way. Like any form of traditional exercise triggers pain.
Yeah. I work with this a lot too. I mean, from the emotional aspect, and this is really common because so many people have a history of disordered eating or currently have disordered eating or disordered relationship with their body. And here's the way I look at it. And again, it's always going to be person specific, but I would say the two biggest factors at play is if somebody has done a lot of the emotional work and they are like, I'm detached from losing weight. Like I don't need the weight loss. And they feel very like comfortable with that. And they've done a lot of healing work on whatever was happening beforehand. Then when they start moving and when they start working out again, a lot of times the nervous system is now actually looking to release a lot of what has still been stored. And so sometimes it might just be things that need to move up and out. It could be that, or it could be just lingering stories that, the nervous system holds on to a lot. Like we can never be perfectly healed. And especially if a lot of the work has been more talk therapy work or at a cognitive level, stuff that's in the nervous system hasn't been released. So it's like when you start moving, you're kind of reactivating all those old stories, even if cognitively you've worked through them.
Yeah. So let's go there. Let's talk about that. Like why a positive mindset and working on at the thought level isn't enough. And what is the level?
Yeah. So the way I explain it is like, right, the brain and the nervous system. And when we're talking about the nervous system, like we're talking about the peripheral nervous system, and the brain is part of the nervous system, right? But it's like, they're a feedback loop and they are both primed through evolution to look for threats. That is their job. They're always going to see threats way more than the emotions we want them to see, like positive things and happiness and joy. They're going to prime to look for that because their job is just to keep you alive. It's all they care about. They don't care about your thriving. They care about that you stay alive, because if you're dead, then you can't thrive. So, I mean, it's a good thing, but it works against us sometimes. So they both need to be on board to see the safety. So a lot of times just the mindset piece is getting our brain on board with it. And we can be so cognitively on board with it. But if our nervous system is on board, it's kind of like, guys, you are not seeing this massive threat that I see. And so it freaks out. And I would say a lot of times when we're using mindset work to try to override what the nervous system is holding on to, it actually amplifies things. Because now the nervous system is like, I'm in a body that is not seeing what I'm seeing, right? It's almost like if someone was like leading you into a room of broken glass everywhere, and someone's dragging you, they're like, it's totally safe. And you're like, no, it's not. Do you not see how, right? You're going to be kicking and thrashing and screaming. Like, what are you crazy? You can't do this. And so it takes getting on the level of the nervous system, which is not logical.
Right.
We cannot logic with the nervous system. We have to see what it sees, understand what it sees, and then update it and help evolve it or whatever it needs. It really could be different things depending on what it's holding on to help it move through and see and get on board with the safety of movement, for example.
Now, I'm sure that's a whole process of getting on board with and that's what you do, like, that's your whole
Yeah.
program. So we can't do that all on today's episode, but can you give us an overview of what that looks like getting on board with your nervous system and starting that work?
Yeah, so I do it through a process. Like my method is the whole self integration method, which is a 4-step method. And one, it's always first making sure, like step one is having the desire for difference. We want to make sure, again, that is more of a cognitive level of like, is that desire actually there to change? And so a great example would be if somebody's like, oh, I need to exercise to lose weight, right? I need to do this because, my doctor told me that if I don't, then this is bad, right? That desire isn't self-led. It's based on other people's expectations. So the first step is just making sure our desires are aligned with our values and not external. And that might just be a shift. We might end up, going to movement. Of course, anyways, it's just how can we do it not because someone told us to or because we need to look different. It's how can we move because it's respectful and loving for our bodies.
Yeah.
And so then step 2 is really meeting yourself where you are, acknowledging that we have a whole history of stories and beliefs and things that have been imprinted onto us from society, and just acknowledging that's the case for everyone. Doesn't matter how much work you've done, how much, how many books you've read on body positivity. At the end of the day, we are all going to be holding on to a lot of influence from other things that we see also a million times a day, and acknowledging any, thoughts, emotions, and beliefs that are there. And so step 3 is really where a lot of the meat of the work comes into play. And it's not even always a perfect linear process, but this is where step 3 is introspective inventory. And that's really, really where we really look at what the nervous system is holding on to. And within that, it's this exploration of the imprints our nervous system holds. And so it's in this exploration where we meet our nervous system, where it is and what it's holding on to. So we work through using a language that the nervous system can understand. And the way I look at it a lot is how you would treat a child who has a fear of like monsters under their bed, for instance. You wouldn't just try to be like, look, there's no monsters. That's ridiculous. Monsters don't exist, right? Like they don't, if this is a 3-year-old, 4-year-old, it doesn't matter how much you tell them that. And in fact, it's going to make them, again, be like, oh my gosh, this person that's trying to protect me isn't seeing the threat. And it's going to make them freak out more. Instead, it's just getting down on their level. And it's like, oh, you're really scared of these monsters under the bed, right? Okay. Like, let's look together. Let's investigate. Like, let's get the data around us. Maybe we build, put in some protective mechanisms, spray some monster spray to help make you feel safe. We develop, a safety plan. We and this is all according to what your nervous system is holding on to. And finding out what it's scared of is part of the process as well. Right. With a child, we already know what it's scared of, but like with the nervous system, we really have to first even ask the questions of like, what is the fear you're holding on to? Because a lot of times we can make assumptions all day long and we're wrong a lot. It's always surprising. It's always like such a fun method to go through that with someone, because it's like what comes out is like, wow, I was not expecting it to go there. That's so fascinating what the nervous system is holding on to. And so it's getting out of our own ways is a lot of the process, and not putting our logic minds on there. So it's then helping the nervous system see the safety and repeating this process. Like, then for this, kid, it's like every day, okay, let's do this check. Let's do this check, help you feel safe. And then it might just take a couple of days. It might not take that long. For other kids, it might take a lot longer, but then it helps the nervous system see, okay, I really am safe. And it starts to evolve and update. And then step 4 is aligned action. That is, we have to then also be taking action. So, and again, it's not a perfect linear process. Sometimes you're taking action alongside it, but it's then what is the next aligned action you can take in life that also helps the nervous system see the safety in that. And helps, that might be doing a new movement pattern or taking a new class or trying a new exercise or whatever that is. And, then helping to see, be like, okay, we did this and we're safe. Yeah. Nobody came to attack us. Like, we're good.
So that clarifies the thing that was coming up in my brain when you were talking about how pain is something that can come up as we're re-engaging with movement. In the example that we gave previously is like, well, how do you tell the difference between pushing through and working through, right?
Yes.
That explains it, right? It's with that sense of safety first and tending to your nervous system that then, there can be, at least as I'm understanding it, some safety for pain to present and it not being this thing we have to plow through and like force down. Am I understanding correctly?
100%, because trying to plow through pain, fix pain, be resistant to pain, right? And a lot of people are like, well, I'm not resistant to my pain. I feel my pain all the time. What do you mean? And it's like, no, but it's like, if you're like, I don't want to, like, if it's like, how do I get rid of my pain? Right? I don't want to feel it, must get rid of it. Or it's like, I'm ignoring it. I'm going to do things anyways, even though I hurt, or I'm just going to, plow through it, or I'm going to completely avoid things because I'm scared it might make it hurt. All of those are actually going to amplify the threat the nervous system is holding on to. Because all of that just enforce to the nervous system that it's something to be feared. So again, they're this constant vicious cycle feedback loop. So every time you're like, oh, pain is bad, must get rid of it, or must immediately stop what I'm doing because I might make it worse. Then the brain's like, they might make it worse. This must be bad. Let me like up level the sensitivity. And then the nervous system is like, holy crap, the sensitivity's been up leveled. This must be bad. And they just like feed. So then you feel more pain and they just feed into each other. And so versus being like, so you sprain, like, again, let's take an acute injury just because it's such a much easier example. There's a big difference between like, oh, the fact is my ankle is sprained. It is now swollen really big and there is an actual injury. Out of love and respect for the healing process of my body, I'm not going to, go running on it or walk on it today. That's a conscious, aligned, intentional decision versus, oh my gosh, I sprained my ankle. What am I going to do about it? My future is ruined. I'm never going to be able to run after my kids, right? Like, there's such a different energy. So yeah, so therefore I got to stay off of it, right? We want to have the intentional, conscious, like aligned choice for whatever we're choosing to do with our bodies when there's pain involved, which might mean moving with pain, or it might mean choosing to rest. It completely depends. And when we can speak the language of our nervous system, that's when we can feel a lot of trust and confidence in our choice.
Right. Where we can do a lunge and recognize my knee hurts. I know what my limit is. Like, I know how far I can push this. It's like, I can feel that pain. I can feel safe that it's here. It can be present. And I don't have to fear that I'm going to cause further damage because I'm on board with my nervous system.
Yeah. And someone who's sensitized when it comes to exercise, a common thing that I would see is that if people aren't used to moving, they're not used to exercising, that when they actually start using certain muscle groups, they hurt just to contract and engage.
Mhm.
And so it might be something when this is where having somebody like yourself who really understands movement, where it's like, okay, where is the pain? What are you feeling in a lunge? And if they're pointing to their quad, they're pointing to the butt, it's like, oh, okay, chances are, and again, it's like, obviously I am coming from the standpoint of anything has been ruled out,
Right.
right? And it's like you've been told, okay, there's nothing going on, or like it's safe to move. And it's like, okay, great. Those are those muscles that are engaging with this movement that's supposed to happen.
Right.
Right. Like that's a good thing versus like, yeah, you're doing a movement and it's like there's a sharp pain right in my knee joint, like on a step up that like, oh, you know what I mean? Like there are definitely times where I've seen also people use this against people, where I've seen people come into, like when I was working in the physical therapy clinic, they're like, oh, they just told me to keep working through it. I'm like, no, like we can modify your form or help you engage different muscles so that you don't feel that too, right? Like there's always both. And that's why having somebody who understands movement, understands form, first and foremost is most important. And then sometimes it is like, okay, form is beautiful. Maybe there is something going on in the joint that we're aware about, but strengthening is the thing that's going to make it feel better. Okay, well, it's safe to do that. Let's monitor it. This is how we strengthen. This is actually what's going to give your joint more space, because strengthening actually helps your joints tremendously, right? And so then you can also help create safety in that way.
Mm-hmm. I love that explanation. It makes so much sense. Okay, so I know that pain to possibility is like the tagline that you use. So let's talk about what becomes possible for people. Like, what have you seen after they get in line with their nervous systems and liberate themselves from chronic pain?
Yeah, it's such a great question, because there's like endless answers to it and what I've seen, because it's so right. The biggest thing that I see is that people are getting in touch with their desires for often the first time. That they realize that they're living this life that they thought that they were supposed to live or thought they had to live. And all of a sudden it's like, wait a minute, like I don't have to work this job that's, stressing me out insanely. I could actually go, do this, or maybe I could even just ask my boss and stand up for myself, right? They have like the safety and confidence to be like, hey, I actually need this raise. Like I'm doing the work of two people. So it's like I've literally seen people go in and get like a massive raise because they now had the capacity to stand up for themselves just based on making that connection with their nervous system, which was done through this type of work. Obviously for people who weren't able to move, being able to move and feel strong in their bodies, that opens up so much for them. Like I had one mom of twins, 3-year-old twins, who wasn't able to bathe them. She wasn't able to lift them. She wasn't able to like be as active as she wanted. And now all of a sudden, because, we worked through the pain and understanding it and helped alleviate it, she was able to be the mom she wanted to her kids. And then, for another woman I worked with, she finally was able to have penetrative sex for the first time without pain. And that opened up a whole new way to, to connect with her partner. For others, it's like they get back to running, which is something that they loved and, gave them such like they loved it for the mental health benefits and the getting outside benefits. And that thing got taken away from them. Other people just dancing in the kitchen with their families or themselves, right? It's just like accessing the freedom to be you. And so really where you go from there is so dependent on what you want in life. And even touching into that for the first time. Or for others, it might be now running a business. I work with a lot of entrepreneurs, and a lot of them, they realize how much pain has been stopping them from using their voice. So it's finally having the safety to just like take up the space and step into themselves.
So amazing. Like, I have never heard anybody talk about pain in this way that is so multi-layered and so holistic. And yeah, and in such a way that not only do you feel better physically, but mentally, emotionally, like spiritually, like it's a whole body experience.
Yeah.
A life experience.
Yeah. Because often pain disconnects us from our essential self. from our true self, whatever you want to call it. Everyone has their own name for it, right? From your own authentic wisdom, because it's like we just got to live in our heads because our bodies feel so unsafe because they're in pain, and that cuts off our mind-body connection, our essential, our connection to the part of us that holds our vitality, our soul, or again, whatever you like to call it, because you can call it anything. It's all getting at the same concept. And so when you've lived in that disconnection for so long, sometimes it's even hard to see how disconnected you are. But when you gain back that connection, it literally gives you your whole life back.
Yeah. Yeah. Which is why I love how you use the word liberate yourself from pain rather than fix your pain. Because it's like,
yes,
very siloed, right? Like fix your pain and this part of your life will be better. Where no, like we liberate ourselves from the pain and all of life improves.
Yes, 100%. And often what I see people stuck in is they are stuck feeling like, and this is where I was too, it is not until my pain is fixed that I can go out and live my life. And often it is the exact opposite, which is hard. It's really hard. This is why I take people through a process, because it's not easy to do I don't think it's actually possible to do by yourself. But it's not really until we're able to start connecting back with our bodies it's that connection back and finding safety in that connection. It is that what is going to desensitize the nervous system. Because in its simplest form, chronic pain is just nervous system sensitization. That's all it is. But it's what's contributing to that. And it's the severing of the mind-body connection that is a massive thing that contributes to that. So it's like you can't fix that without connecting back to yourself.
Yeah.
And
it's not a band-aid solution. It's not like there's a root issue here and we just got to dig down to the root.
Yes.
Okay. So you said, I agree with you. This is impossible to do on your own, or very likely impossible to do on your own. So please tell our listeners how they can stay in touch with you, and if they should like to work with you, how they can do that.
Absolutely. Yeah. The best way to stay in touch is check out my podcast, the Unweaving Chronic Pain Podcast, if you're a podcast listener, obviously, because I have a whole wealth of information on there. And then if you're into social media, I'm most active on Instagram at Dr. Andrea Moore. And DM me, like it's me there. Like I love chatting with people. So please feel free to message me. I have my core offers are on there, that you can check them out. But I do always have sometimes other things behind the scenes or smaller packages. So make sure you get on my newsletter to find that out, or again, just DM me to see what might be going on and that I haven't actually announced officially on Instagram, because that's always the case. But yeah, those are the best places to hang out with me.
Well, thank you so very much for coming on and sharing your wisdom with our listeners today. This has been a really value-packed episode, and we really, really appreciate your time. Is there anything you want to share before we sign off for the day?
I think the biggest thing is that if you are someone who has pain, clearly you're listening to this episode, and that just shows me that you are someone who's willing to go there, right? To do this work, to discover more. So just know that is enough. And that's so much of what it takes, is that willingness. And if you have been told, there's nothing you can do, or it's all in your head, or you've been made to feel, crazy for your pain, or like that something is wrong with you, that there's absolutely another way. And your pain is here to send you a message. And it's just about learning the language so you can hear it.
That's a beautiful note to finish on. Thanks so much for being here today, Dr. Andrea. I really appreciate your time.
Thank you for having me. I really enjoyed this.